Hello, I'm Dr. Basil Considine. I'm here from the ACU Online Writing Center, and today we're going to be doing another webinar in our Writing as a Nurse series. This one entitled Variable Tables and Evidence-Based Projects. The contents of this webinar will be particularly of interest to you if you are working on a quantitative or mixed methods research, and especially if you are in our DNP or BSN to DNP program and you are preparing to design a evidence-based project, because we'll be looking at some things about how you select and identify variables, how you quantify the things that you are tracking, how you arrange this material in an organized fashion. And we'll be using the lens of a particular assignment here. Briefly, if you're not familiar with the Writing Center, we work with students in Abilene Christian University's online programs for no cost. There are some writing centers that charge for this. Looked at one of our peer universities that charged more than $60 an hour, which would be, I think, an incentive to not go to the writing center as often. But in our case, it is included in your tuition, so come as often as you want. Each student can make up to 2 appointments per week, no charge for any of that. We also have webinars such as this. We are available for both asynchronous appointments where you submit your draft and we send you feedback generally within 24 hours, as well as phone or Zoom appointments that you can request by sending an email to onlinewritingcenter@acu.edu. Just to make the distinction, if you're signing up for an asynchronous appointment, you can do that through the WC Online system. You access that now through the my.acu.edu portal, and you can just make that appointment anytime you want. Look for a slot that works with your schedule, sign up for it. By the time that appointment slot rolls around, upload a copy of your paper for us to look at. If you are looking to have a real-time consultation, send us in that email to onlinewritingcenter@acu.edu. Give us a brief description of what you're looking for help with and a range of possible times that will work for you. It's helpful if you give us some advance notice so we can align with our schedules. If it happens that you are asking for, 2 weeks ahead, say week 3 of the semester, yeah, generally not a problem. If you're asking a week ahead for week 4, not a problem. If you're asking in week 6, well, that is the busiest time of the year for many students and for our staff as well. So, make sure you would ask sooner rather than later if you have a request like that going in. But asynchronous appointments, if you see an opening on the schedule and you haven't reached your 2 appointment maximum for the week, just go ahead and sign up. And that's that. We have a couple webinars coming up this term that might be of interest to you. Several about APA style and adding synthesis. We have a literature review focused webinar being released in the middle of November. That may be of particular interest to these people who are watching this for the nursing program, because you have to do a literature review in growing stages for your DMP project, as well as to inform the selection of the final variables and other things like that for your evidence-based project. All right, let us dive into the main body of our content today. We're going to be working in 4 different sections. First, we're going to review some variable-related terminology. And this is not a substitute for doing the course reading. This is a supplement to remind you and to clarify some points of common confusion. So if you are watching this next section and you think, gosh, that's all new to me, I would suggest doing the course reading, or there are numerous webinars, including on our page, that have additional detail on this. You can also, when you get to the second section, when we're looking at APA table formatting, we have a couple dedicated webinars for that on the ACU Online Writing Center website and on our YouTube channel. Then we're going to delve specifically into Nursing 648's Week 3 Assignment 1 and talk through that, understand the different things that it's asking you to do and how to arrange, to format, how to plan this. And then we'll finish with a section on drafting and outlining, which includes some suggestions from your professor on this particular assignment. All right, with no further ado, let's talk about those variables. So in the context of a research study, what is a variable? Well, take it from the Hauser text. a characteristic event or response that represents the elements of the research question in a detectable way. Now, there are a couple salient features here that we should focus on. That first one is the last bit in this quote, in a detectable way. So we want something that can be measured. And it shouldn't just be an arbitrary thing. It should be something that we believe based on professional experience, the literature review, and other factors that we believe is an element of this research question, that it will potentially, at least, affect what the answer to the question might be. And then, is it going to be directly answering that? No, a research question is generally not something along the lines of, oh, what is the average measure of, let's say, blood glucose in people who have eaten dinner an hour ago? That's more of the kind of question that you would answer to as a preliminary to answering a research question such as, oh, what are the medical concerns when working with patients who have just eaten a meal recently? Now, there's a distinction there, just like interview questions are going to be means to an end to answering a research question. You want to make sure that the variables you're selecting are something that at least has the perceived potential of being able to allow you to answer a research question. There may be descriptive statistics that you generate along the way, but again, there's a difference between, okay, well, let's just calculate what this is versus let's try and gather a broad piece of data so that we can answer this larger research question that has to do with, in our case, practice. Now, variables are primarily used in quantitative and mixed methods research. This is in part because qualitative research is often, not exclusively, but often designed to identify the things that you are going to investigate more thoroughly or in a more systematic fashion in quantitative research. But also, if you are trying to answer questions about, well, is this effective? Should we change this? Well, that's something where you want to have numbers on your side as much as possible, hence quantitative research. But it can be used in qualitative research and does come up. So this assignment refers to a number of different variable types. So let's unpack some of the terminology. So descriptive variables are variables that describe the sample or some other characteristic of the phenomenon that's under study. So the idea is it's telling us something about this thing we are investigating. Now, descriptive variables, you collect them, but they're not being controlled or manipulated by the researcher, at least not after the participant is recruited into the study. So if we're, say, tracking the age of the participant, well, you're not going to put your participant in a time machine and send them 10 years into the past so that you can measure them what they're like 10 years later. I mean, if you're doing a longitudinal study, you could wait 10 years, but there's no magic way to affect the participant ages. Or if you have a time machine, let's talk. I've got a sports book and a plan. That's a Back to the Future 2 joke for you. All right, so not controlled or manipulated by the researcher. So this is often something that is innate to the participants when they enroll in the study. It could be something that they are evaluating, that they're quantifying and how they perceive it, like how much they're in pain, or how they choose to rate. Say they fill out a survey when they're leaving saying, oh, yes, this was very effective, or I like that, or yes, I do think I will follow this, or I did follow that, as the case may be. So these descriptive variables, you can analyze them to see if there are some associations, but you're not looking them as cause and effect, at least not for the purpose of what we're doing. Now, there are different types of studies that may be looking for different things, and we'll talk about that more in a bit, because if you are trying to look for correlations, that's different from if you're trying to prove causation. proving causation generally requires a true experiment where, say, if you were measuring the effect of a drug on someone, you might have your control group. People don't get it. And then a group where people get this at a certain dose. There's another one where people get it as a much higher dose. And so those are things that are being controlled by the researcher. They're being manipulated by the researcher. So those would not be descriptive variables. The descriptive variable would be like, oh, well, what's the race, ethnicity of the patient? So long as it's not being controlled by the study, like you're not giving people liposuction, say, or putting them on diets, what their weight might be, their body mass index, BMI. So, it's a question of, is this something that is being directly influenced by the study, but because the researcher is manipulating this, or is this something we're going to see, okay, does this correlate? Like, for example, if you have patients who happen to be drinking grapefruit juice. Well, it has a well-known pharmacological interactions where some drugs just do not work well if the patient drinks grapefruit juice. And that is something that if you're not telling the patients do this or not, then it's not being manipulated by the researcher, but you can still track it and say, have the patients fill out a food log and say, hold on, wait, we noticed this thing where 50% of our patients who drank grapefruit juice, this happened. Is that significant? And so that's getting into the analyzing for association. But because you weren't telling this group drink grapefruit juice and this group not, or giving them something that they're not sure whether it's a placebo or not that may or may not have grapefruit juice, it's not being directly used for cause and effect determination. That would be a separate study versus you're like, we were tracking what they're eating, and those who had grapefruit juice, there's this thing that's different. Okay, so some examples of descriptive variables: any sort of demographic data, general tracking participant characteristics, perceptual measures, attitudinal measures. Some great confusion happens because of the ways that some of these labels can overlap. And a frequent place where there's confusion related to this is with independent and dependent variables, because these are things that are in some experiments getting manipulated, and in other studies they're being used as kind of a shorthand for things, even though there's a more proper name for that in that type of research. So briefly, an independent variable is something that is being externally manipulated, that we're evaluating for cause and the cause and effect. So if you have an intervention where 50 people watch a video and 50 people do not, well, whether or not they're watching that video is going to be an independent variable because you as the experimenter, you're manipulating it. So we're evaluating it for cause. Now, the dependent variable would be something that we at least are testing to see if it's being changed by the independent variable. We're looking for the effect in cause and effect. Now, let's illustrate that, and we're going to describe a type of experiment I sure hope that you never do, because this would be a terrible one. Let's say that we are doing a experiment where we are looking at how employees respond to different types of communication, and we decide that as part of our experiment, we're going to have an independent variable, how much employees are yelled at. Again, please don't do this experiment. If you tried, I hope that the internal review board will block this both at ACU and the study site, so please don't propose it. But let's say that you have your independent variable being how much employees are yelled at. And then we go and you blood test the employees after they're yelled at to check their stress hormone levels, things like cortisol and catecholamines. Well, leaving the ethical implications of yelling at people aside, what is being controlled here? What is being manipulated? Oh, we're just deciding how much to yell at. Now, that can have multiple potential values. It could be, let's say, we didn't yell at them, so 0 minutes. We yelled at them for 10 minutes. Yelled at them for 20 minutes. Now, you can code that variable different ways. You could just code it as yes or no, and that would be fine probably for assessing, okay, how do employees feel about being yelled at? Do they like it or not? But if you're trying to determine what the optimal level of yelling at them is for productivity, first, please don't do that. That sounds terrible and cruel to your participants. And second, if you were doing that, well, you'd probably want to try and find out what the optimal amount of yelling was. So you'd want to have multiple different sets of data there. And you might find that you don't get a statistically significant response until you reach a certain threshold. And then probably there'd be a point of diminishing returns. You yell at them for 2 hours, your employees quit and withdraw from the study, or something like that. So again, please don't do this experiment, but I hope you get the idea that in this case, there is one thing that is being manipulated, the how much you're yelling at employees, and then the thing that you at least believe is being changed, and the experiment is in part designed to confirm whether or not their stress hormone levels change. Spoiler, most people, their stress level and stress hormone levels will be elevated by being yelled at. Okay, so also in there, descriptive variables, that's something that we're going to be talking about in this particular assignment that under analysis. So this is a type of thing that is reported. So our descriptive variables, again, are being reported without being manipulated or controlled here, which makes them not independent variables. They're using them to generate a more complex kind of composite understanding of the study subjects, understand who we were referring to. So if all you tracked was, say, gender, that's not going to give you a great understanding of other things that describe the people who are involved in it. You might also look at, depending on your studies, socioeconomic status, race, ethnicity, age, physical fitness, body weight, height, other things like that that create a more nuanced understanding. And it's not that you're tracking the descriptive variable specifically to try and determine, if I change this, that what effect this has, because these are generally hard to manipulate directly like that. But you can still use them potentially to explore associations. And often what happens is someone will collect a data set for something, and then they'll say, we've noticed a statistically significant association between people with these factors that we tracked as descriptive variables and this phenomenon. And so we're going to design the next study to do that. For those of you who are familiar with the Framingham Heart Study, which is a very long-running longitudinal study that started in Framingham, Massachusetts, where they tracked a large cohort of people across multiple decades and are still tracking. Well, this is something where they have gone in and looked at the descriptive variables that were tracked as part of this very large data set and said, oh, isn't this interesting? We've noticed all sorts of things. And so the fact that you're tracking them, but you can't manipulate them, doesn't mean they don't have anything interesting to tell you. It's just that they are not being used specifically, at least at this point, to try and determine a cause and effect relationship. That's something where if you notice a pattern, then you can do a separate study to do it, where one or more of those can be manipulated directly. Predictive studies. So within the realm of descriptive research, there's a subgenre called predictive studies where we have predictor variables and outcome variables. Now, these are similar but not quite the same thing as independent variables and dependent variables, because the predictor, we're particularly looking at, okay, does this lead to this specific outcome or result? And if you think that's something that sounds a little confusing, don't worry, lots of people have confusion with this. So let me say a little bit more. So if we're doing a predictive study design in particular, so yeah, we are going to be looking at what the function of the variables here is. And so specifically in a predictive study, you're trying to determine whether this causes the other thing. So, for example, if we're doing a predictive study on, let's say, we are looking at patients who are under chemotherapy who have multiple visits for not for treatment, but for related comorbidities. And so you're looking at it and saying, okay, so what might predict this? What seems to be the causative factor here? And so because we're looking at it in that particular way, trying to see, do we get this outcome from that specifically? Then we have the predictor variable that we're looking and evaluating. Does this lead to this in a statistically significant sense? And the thing that's leading to is the outcome variable. And again, I'll refer you back to the course reading if you need a little bit more of a refresh on this. Now, there are also extraneous variables. Now, these are things that might affect the outcome of the study, but are not part of the experiment or not part of the evidence-based project that you are conducting. And in particular, we're concerned with confounding variables. These are extraneous variables that might obscure or inhibit the effects of one or more independent variables. And it's a general principle of good research design that you want to minimize or eliminate confounding variables. Now, what might come up with that? Well, let's say that you are looking at the effect of, say, smoking. Now, smoking has many things. You can develop emphysema, COPD, increased risk of lung cancer, etc. But if your mortality is very high and your average lifespan is quite low, this might not register as much as when people live long enough to develop visible cancer and get to advanced stages and things like that. So in that case, you might have a low longevity as a confounding thing. So the confounding variable would be the longevity, and the fact that your data set was biased in that respect with having low longevity might obscure the effect of smoking. Another thing, alcohol, that has many medical drug interactions. And so if your participants are drinking, that might prevent you from noticing that the drug has the potential to be effective because it is in some portion of the participants being inhibited by the fact that they're drinking. And so there are things that you might be tracking so that you can rule it out if you notice something there. And so you start working with subsets of the data. You might be looking retroactively for a cause for something where the data is not showing you what was predicted. And overall, you want to anticipate these as much as possible so that you can minimize or eliminate them from consideration. And sometimes that involves a delimitation in your research design or your participant recruitment to skew away from a particular population, which is fine, but you want to acknowledge that and be aware that this does tend to bias your results somewhat. Because if you're not working with a true representative sample of the population, then your findings may not be generalizable. All right, some more related things. So if you're working with correlation research, this is investigating first whether potential relationships exist, and if so, how strong they are, because you might find a weak relationship, but it's not statistically significant. And so you might go in and see, okay, were there any confounding variables that are stopping us from seeing a statistically significant relationship? You might go and say, okay, well, what if we change the dosage of this? Several different things. And predictive research is where we're, again, investigating whether the values for variables at a particular point in time, and this is when we're measuring them, predict outcomes as measured, again, at a different point in time. So, for example, if we're looking at does the zip code of someone's birth correlate to their average longevity? Spoilers, the answer is yes, it correlates with all sorts of things, including education level. Is it 100% correlation? No. Is it very strong in some areas, especially where there's high contrast in relative affluence and access to healthcare? Absolutely. Now, if you were trying to measure their average longevity shortly after birth, that's not going to be very helpful. So, you want to look at a point in time for that measurement of longevity that is sufficiently after the event of the birth that you can find meaningful results. And so in the United States, where the average lifespan is now getting pretty high, you'd want to set that high enough to look. And this does, of course, impose some constraints of, well, if you're trying to see if being born in this zip code within this range of years influences your average longevity, you need to go long enough to get meaningful results about longevity. Because if we go to age 20, it's not going to be nearly as much data on when people are actually dying as if we went out to, say, 90 or 100 years. Now, in terms of an evidence-based practice, this usually comes up when you are looking at, say, the results of an intervention that you're doing. And so you want to measure what you get at different times. And depending on the intervention, it might be right after the intervention, it might be a week after, it might be a month after, and see, okay, what's the effect here? And you might be tracking all of those things with multiple post tests because you're trying to determine, is this effective over time or just in the moment? And therefore, how should we invest in it? So related to this, if we shift the conversation to the evidence-based practice PICO questions that you've been drafting in other classes, well, we are looking to answer this question in part because there's a follow-up question that you want to answer, which is, should whatever this practice is be changed to include a new, in this case meaning not currently used or used at the project site, intervention, or is it better to continue with the current policy or procedure with the specific population? And this is not something that the study is designed to answer directly, that your study is or project is designed to answer the PICO question itself. But there's that extra step that follows when you say, okay, well, based on, we have noticed that X has this statistically significant effect with this group at our population done in this way. What should we do with these results? And that is moving into the, oh, okay, well, there's significant evidence to do this, so let's do this, hopefully. And that do this might be stay with the same thing because that other thing is neatly expensive and exposes participants to increased risk. Or it could be something as simple as, okay, well, there's very strong data showing that this is cheaper, patients like it better, hospital staff like it, and we just need to invest in this thing or do this practice. Now, when you are answering your evidence-based practice PICO question, you want to make sure that the variables that you are tracking, and these are the variables that you'll be drafting and putting in your table for this assignment we're looking at, that there's a clear potential to influence the answers. And how do you know the clear potential? Well, there are two main ways that you can in this context. Ideally, it will be both, suggested by the literature or suggested by your professional experience and practice. And there are varying levels that you might depend on, either depending on what type of research and how much prior literature there is. So for example, many of my students have written projects that started with the, okay, well, the guidelines say to do this, but we've found that this isn't effective with this population. And therefore we are trying this thing that is not described in the literature, but we have noticed this. Or I did a analysis of patient records and noticed this thing, which is not what was predicted by this. Therefore, we're going to go look and see if this thing works or this thing doesn't work with that group. And so the variables would involve whatever things were being affected by the intervention. Let's move on to table formatting now. So something important to remember is that tables are largely the same in APA 6 and APA 7 with one main exception, which is how they're labeled. More on that in a moment. How these tables look is going to be different from how SPSS outputs tables by default. Let me say that again. If you're using SPSS to generate data or to output data that you've been collecting and your descriptive statistics therein, you will find that if you just use the default options, you will get something that you need to reformat so that it looks right in APA 7th edition. You can do some export settings in the current version of SPSS to minimize this, but you're still going to want to take a look and make sure that it is formatted correctly in APA 7. Now, in the APA 7 and manual, these are in pages 191 to 206 with another 18 pages of examples after that. The online instructions, or a short form version of those, can be found on apa.org. Got a link here. And here's the very short version. First, you need to number the tables. The number goes in the table label, which gets bolded. There'll be table 1, table 2, etc. And then the table title follows that, and it should be italicized and formatted in title case, meaning, among other things, the first letter of any word with 4 or more letters gets capitalized. Your tables should also not have any vertical lines in them, and no horizontal lines in the body of the table. You might be asking, what does that mean? And don't worry, I'm going to show you an example in just a moment. So here's an example of some raw SPSS output from the program. It's being exported from the program into a Word document, and it's not an APA style. So how do I know that it's not an APA style? Well, there are a couple things about how APA style deals with statistics. So for example, this statistical symbol R, that should be italicized. This should be written with an italicized R, and then the square indicated by the superscript 2. Same thing for this one here. And then here, the standard error would get abbreviated just as an italicized SE. This would be italicized. There we have an abbreviation MS for that. This should be italicized. There's a beta should be italicized. Again, this should be SE. This should be italicized T. So, we see that there are many little things that need to be modified, including we would need to number these. So, if this was the first one, this would be table 1, and then the name of the title here would get moved flash left, and this would be italicized. Basically, just looking at this, we can see this is not in APA 7. All right. So what should that look like? Well, here's an example here. What's our table number here? Oh, this is table 3. What's the title? Prevalence of 6 illnesses in male infants and female infants. And you can see the title here is italicized. It's a title case. So these short, unimportant words aren't capitalized. And when you have something that should normally be italicized, like N, meaning the sample number here, that when it's in text that is being italicized, we reverse it. So what would normally be italicized here in the italicized title becomes not italicized. And you'll see in terms of lines, we have no vertical lines in this table. We have this horizontal line here at the very top of the table. We've got one here at the bottom of the header row, and then another one here at the very bottom. These little ones are showing a grouping of different sets. So there's specifically separated these out. This is called disaggregated the data by gender. Now, you could have a table that had this written out as gender, and then male and female, and have a separate row there. But if you have cause to believe that there is a notable difference here or a potential difference there, it'll be easier to see the difference if you have it broken into different columns here, which is why it's being disaggregated here. As the title even tells you here, this is the prevalence of these illnesses in male infants and female infants. For what period? In the first year of life. All right, some more examples of tables here. And again, you can see that we have the vertical lines above and below the table row. The table row is this one here, the labels of everything there, including our variables. And then these are just notes about the table corresponding to the different explanatory labels. And in this example on the right, you'll see that we have some sub things here. So we have the larger measure, cognitive appraisals, and there are three things within that category, and that's why they're indented here. So you can see these different ways that formatting is used to make it more clear. And in this particular example, when you look at the urban and rural categories here, you can see that there isn't a line there like there was on the previous page. That's fine. It still gives us a sense from how these are centered at, oh, these come for this, that come to that. So don't worry about that particular formatting. Same thing about whether this is at the top or the bottom. They are both acceptable. All right. So at this point, let us turn to the assignment here. We're going to be looking at Nursing 648's Week 3 Assignment 1, Fleshing Out Your Evidence-Based Practice Project. So this webinar here, we're going to finish by looking at this assignment and talking about how to translate these instructions into drafting up your paper, drafting your table. So the assignment instructions begin with a preamble that there are two parts, the paper outlining your proposed project idea and a table that will be included as an appendix. All right. Create an initial variable table for your project based on your PICO and literature review from course 612. The table should be an exhaustive list of potential population, which are descriptive variables, the intervention or events, and the outcome variables. So when it says exhaustive list, this doesn't mean all the possible ones, but all those that you are planning on tracking in your proposed project. These are variables you might collect if you were to move forward with your PICO question and should reflect your literature search findings. So you should be able to justify why these. And it could be someone else tracked this and found something important, or this was important in this other study, or this is suggested by the reading where someone said, oh, this should be looked at next. And you can use citations to anchor those decisions. You should include at least first 3 variables specific to the population. Those will be the descriptive variables, 2 variables specific to your intervention, and at least 2 outcome variables for your project. Okay, pretty straightforward. We've got a list. We know we're going to need at least 7 variables here. All right, for the paper part, for the 2-page paper, include an introduction of your PICO and proposed project idea, in which you need to describe what level of mentoring you'll need to be able to accomplish this project in the organization. Okay, that's part 1. Discuss what teams and individuals you'll need to work with to obtain the buy-in to move forward with your project. Okay, part 2. And 3, additionally discuss who could mentor you in your organization or externally to help you accomplish this project. And within that, you should specifically be describing 2 ways in which a mentor would be beneficial to you. So that's 3 main content areas that are being required, besides, of course, the introduction and the conclusion that you'll have. All right, pretty straightforward. And since it's 2 pages, that gives us an idea of the length. More about that in the drafting section. All right, then, as part of the appendix, create a table that includes the descriptives of the potential population, intervention event, and outcome variables. So this is specifically saying that table referenced earlier, it should go in as an appendix. The table should be broken out by population, intervention, and outcomes. Okay, so that breaking out. So if we look back at this table here on the right, you will see that we do have cognitive appraisals, which is broken out into these 3 categories. That is the sort of breakdown that the instructions are asking you to do. All right, let's see. The table should be broken out by population, intervention, and outcomes. Okay, so 3 sub areas, 3 ways of sorting the variables in the table. And specifically, you need to include variable name, description, data source, okay, what you're going to get this from, possible range of values, the time frame or length of time for collection, who would assist in data collection or providing intervention, and what groups or individuals you'll need to seek collaboration to collect that data. Okay, and note that that's groups or individuals, plural, so very likely there may be more than one entity or individual that you need to list there. It would be helpful on that one to not list people by name because your reader, the professor, won't necessarily know who that person is in that organization or what role you're trying to tap them from. But if it's, say, the data management specialist or the internal review board for that organization, okay, put that down and then we see that's who's involved. Specifications, okay, 2-page paper with variable table in the appendix, at least 3 references less than 5 years old, standard APA formatting, and let's look at the rubric and see how this relates to the assignment instructions. So it specifically says there must be an introduction with a brief synopsis of the project idea before you dive into the 3 main elements here. You must have that table, it must be in the appendix, and have that breakdown. And then it's going to be 2 pages for the body of the paper. And remember to have recent sources. And if you're wondering, well, why does it need to be recent? Well, we're trying to work with relevant, active, pressing problems in healthcare today. And one of the things to do is to keep in mind that healthcare provision has changed in the United States significantly over the last 20 years. The passage of the Affordable Care Act, whatever you may think about it in terms of governance, it has had an undeniable effect on how healthcare is processed, and including things like how records are managed and patterns for patients seeking treatment. So we want to make sure that you are grounding your project in current research. And so one way to help ensure that is to require you to use more recent searches. And if they're less than 5 years old, it's more likely that they will remain current as you get to the point where you're done with coursework and completing the actual project. Okay, let us now move on to our next section. So for this next section, we are going to be doing 2 things. First, before we begin, some reminders, including make sure that you respond to each prompt directly and then follow up in detail. Often we don't get the succinct version until the end of the paragraph, and that's not nearly as helpful as when you tell the reader why you're discussing these things at the start. In this case, we're probably not going to be using many I statements, but when you are referring to people that you want to recruit as mentors, there may be salient, important, relevant things that are best expressed that way. So if you are doing something like that, I have worked with this person for 10 years and they have offered to assist, great. That's a perfect example of how an I statement can be helpful at telling us exactly what's going on. You want to use the language of the prompt so it's clear that you are stating exactly what the professor is asking. Consistent word choices to refer to the same things, especially with those variables. And use the rubric and instructions to come up with approximate headings, organization, and section lengths. Since you are required to cite a number of outside sources for this, if you have any questions about citing them, you can look at the official APA examples on APA style. You can email the Online Writing Center, just give us as much information as you have. And of course, the APA manual has many more examples than are found online. We are going to be using the APA course paper template here. If you don't have a copy of this, I recommend pausing for a moment and then you can download a copy of the template to use here. All right, now that you have your copy of the template, let's talk about a couple things. First, I did check in with the course instructor and very kindly relayed a few words of advice. First, a reminder to include an introduction paragraph that's actually specified in the instructions, but make sure that you include an introduction paragraph that has a clear thesis statement. Tell us what is this paper about? What are you trying to do? What's the goal of your project? That sort of thing. Use headings to organize the paper content. Okay, great. So specifically, we want to make sure we have headings here, not just in general principles, but because the instructor is specifically saying to do that. And clarification that the 2-page limit refers to the body of the paper, so meaning we're not counting the title page, the references, or appendix. And you shouldn't have an abstract for this assignment because it's just 2 pages of body plus the appendix. So reminders for the intro paragraph, you want to add it, but it does not get a heading. It's actually an APA rule that the introduction section does not get a heading called introduction. Let's start out with a heading or subheading for each prompt and give us a conclusion with a heading. Now, at this point, we're going to head back to that template. So if you didn't grab it before, now's the time to do it because we are going to be switching over to look at that. All right, you should now see that I'm sharing my screen and I am running the latest version of Word on the Mac. I am using our course paper template. If you are using Office 365, the online version of Word, I will say that you can do pretty much everything that you see me doing, but the options will look a little bit different because it's a simplified web layout and it's sometimes more time consuming to do. So if you have the choice, I recommend using the desktop version of Word. If you are working on a tablet and you can only use Office 365, well, just keep in mind that things might look a little bit different. All right, so I have this template here, and the first thing that I'm going to do is I'm going to go ahead and I'm going to clear out this placeholder text. Just going to go ahead and select that and delete it. Same thing with the placeholders for the reference. And now we're going to go back to the assignment instructions and we're going to use those as a basis for the draft. And for this, we are literally going to start by copying and pasting the assignment instructions. Why? Well, this does give us a clear description of what's supposed to go in each section, so you can cross it off as you go to make sure that you're getting everything that you need. So because there is the body of the paper and the table, then we're going to go ahead and transport all that information to the appendix. And so it's starting with this part here. All right, now something you'll notice here is that the template here doesn't include a section for the appendix. Let me zoom out a little bit so you can see. Right now, our last thing is the references page. That's not a problem. I'm just going to go to Insert and Break and insert a page break. This is Command Enter on a Mac, Control Enter on a PC. Pops us to the new page. And I'm going to go ahead and I'm going to type appendix. No, there's no A or B or anything because it's the only appendix here, but we're going to title the appendix, and that's going to be variables table. The title does not need to be fancy, it just needs to be descriptive here. And you can see that I have here this menu of different styles. You can also get to it with the styles pane button. And what this does is it contains a set of rules for how things should look. And so you'll notice that references is bolded and centered. Well, if I go ahead and I select this text and I apply APA level 1, that gets bolded and centered. So great, now our heading is formatted the way it should look. And let's start moving this information around. Now the appendix does go after the references section, and so make sure you get that correct. All right, so let's look at the table creation process. And this is something that many students haven't done in a while, so I'm going to talk through it. If you are familiar with this, you might want to go ahead and speed through this bit as I explain the instructions. So we have a number of different things we can use here. If you go to the menu at the top of the screen, you can select table and insert table. You can also go to the insert tab here and you see this table button, and it has an option to draw a table with various characteristics. Now, if you are looking at this and trying to guess how many should be there, you can certainly count these out and try a best guess. Most people find that if they just start adding a table and expanding it with new rows or new columns as they go, that is easier, faster for them. But let's take a look at what we have here. We have three different breakdowns: potential populations, descriptive variables, the intervention or event, and the outcome variables. All right, so we're going to need at least, based on our count earlier, I think that is at least 8 rows. Let's double check. Sorry, at least 7 for those 3 population, 2 for the intervention, and 2 for the outcome. All right, so that's at least 7. Plus, we're going to be breaking it down into those 3 categories. And so that means we're going to need a row for each. So that's 7 plus 3, that's 10. And we also want to have a heading row, so that means 8. So I don't know how many columns we're going to have yet, but let's go ahead and say we are going to require at least 11. And so that's 7 plus 3 plus 1. And we are going to also need to have some columns for these. So let's just start out with the assumption that we are going to want 1 column for each of these. So that's 6 bullets. So let's start out with our column. I'm going to use the table tool. So insert on the ribbon, table, and then I can just use this and say, okay, we want to have 6 columns and start out with well, this wizard only goes to 10, but we can add that quickly. And so I'm going to go ahead and I'm going to right click, control click if you're on a Mac, and going to insert 2 rows below. All right, so let's just start putting in things here and see what we come up with. So we have these 6 things here. So let's go ahead and enter those first. Variable name, variable description, data source. Now you can certainly make these labels more concise, but let's start from a point of just accurately translating the instructions. You may notice that I'm entering these in title case. And then we want to start putting in our different labels here for the variable names. Now, again, we have, according to the instructions, we need to break this down into population, intervention, and outcomes. All right, so we're going to have population, intervention, outcomes. Now, if you're wondering why I broke it down this way, looks like we're off on our count by 1, so let me add another row here. We want to have at least that many because the instructions told us that we should have at least 3. And we'll go ahead and grab this instruction and move it down here so we can see it. Again, you want to have the instructions in the part that you're looking at so you can make sure that you have incorporated them. And you can cross them off as you go. All right, so looking at this here, population, intervention, outcomes, great. So we have our breakdown there. We have these added, so we can cross that out and say we did it. If you prefer, you can just delete it, but right now we're just crossing out so you can see which parts of this have been specified so far. All right, we're going to cross that off. All right, so this is really just telling us now we need to fill in those things for the table now. Great. So how would we format these? Well, we'll just add a couple spaces here, and let's say that we are tracking, for the sake of example here, let's say that we are tracking BMI. I know it's an imperfect measurement, but it is one that allows for a lot of comparisons with prior research. All right, so BMI, let's say age. And let's say that we are also tracking race, ethnicity. All right, and intervention outcomes, we're going to circle back here, but you can see how this use of just a couple spaces to add indentation makes it easier to track. Now, looking at this, you might say, well, there's not a clear order there. We go from BMI to age and years to race or ethnicity. And sometimes you're prioritizing it according to what you think will be the most important, in which case you need to tell the reader that somewhere. Other times you are doing it to align with the order in a table somewhere else, perhaps someone else's research table. So you want to give a note about that. But all else being equal, if there's no particular rationale for why that order, it's helpful to just list them alphabetically because it makes the table very easy to read. And you could say, okay, that's alphabetical. They shouldn't read anything into the order. It's just in alphabetical order. All right, so now let's look at this table here, and we want to do some formatting. I'm just going to add a page break here so we can see this all on one page. So let's talk about how to make this look like an APA 7 table. So first I'm going to select the whole table. I just clicked on this checkbox in the upper left-hand corner. I'm going to zoom in just a little bit so you can see this more clearly. And you'll see here that when I have the whole table selected, if I right-click or control-click on a Mac, that I have a number of options here, including borders and shading here. Now, there's more than one way to do this. This one has a nice, we're looking at pretty much everything at once, bird's eye view. So if we start with none, that will remove all the borders here. We won't see this in effect here until we click on OK, but we can say, okay, we know we need to remove all of the vertical lines, so they're gone now. And for horizontal lines, we just need one at the very top, one at the very bottom, and then one at the bottom of the table header row. So we need to do this in two steps. First, we'll do this for the table as a whole, just getting rid of everything except the very top, the very bottom lines. And then if we just select the table row and we do the same thing, select, right-click, borders and shading, and then turn on the bottom row line, that does the bottom for our selection, like so. All right, that was one way. I'm going to show you the other way. All right, so we're back to our default table with all those lines there right as they were when we created. So if on the ribbon we go to table layout, this layout button, we'll see that there are things to cosmetically affect where things are. People often go there, but we're talking about the visual appearance, that which is under the design tab. So often I get people saying, I went to layout, I couldn't find the options. That's because we're looking at the appearance, so think design, table design. And you'll see that there's a borders button here. And so for, again, for whatever parts of the table we have selected, we can use this to turn off or on different borders. So if I select no border, it gets rid of all the borders for the selection. If I select this and say bottom border, we have this border at the bottom of the screen here, at the bottom of the table. If I select top border, we get this line at the top. And now just selecting that header row, if I select bottom border again, we now have the only horizontal lines we need. Now, although you'll find examples of both, in general, the most readable way of laying this out is to have the text be aligned with the bottom edge there. Tends to look the most elegant. And you can also condense these names, but let's start out with just having them, and you can go and come up with a more concise way of writing that later. All right, so here we would put in the description of whatever that thing. This is the shorthand that you use for tracking it. This would be the more extended thing. You're probably not going to need much of a description for the population variables, but for the intervention, probably it'll be a little bit longer. So before us to go any further, we're going to need a sample PICO question here. So let's go ahead with let's look at how this would come up when outlining this. So this is a good time to start putting in our headings here. All right, so the first thing you're going to need is that introduction to the PICO and the proposed project idea. And then this section, let's call this mentoring needs. And using these headings here, well, this is going to be the first heading in the paper. So we use APA level 1. And again, you can access that up here or by popping out the styles menu and selecting the same thing from the list that pops up here. We'll just use the one up top because it's convenient. Mentoring needs, okay, APA level 1 heading. And then the next thing, so what teams or individuals to get buy-in? All right, we'll call that buy-in needs. Again, that'll be an APA level 1 because it's on the same level as this. And then, potential mentors. All right, same thing. And we have, we need data collection collaborators. And same thing, we're going to make that an APA level 1 heading. And now we have 4 headings here laying out the content of the paper. We just need to add a conclusion. And great, we've got headings here. Headings that align with the assignment instructions here. Okay, so let's talk about proposed PICOs. So I've pasted in here a sample PICO question. In college-aged adults, what is the effect of a school-based physical activity program on a reduction in the incidence of adult obesity compared with no intervention? Now, let's not focus on the elements of this question as far as whether you would want to do it or not, but let's focus on how this would translate into the different variables that are being tracked in this. All right, college-age adults. Why might you want to do this? Well, if you're doing research on children, that's not only a different set of confounding factors that you'd have to deal with, but also you have the different permissions process, because children are a vulnerable population, and so there are more IRB concerns. Now, if you're working with college-age adults, then they are legally able to, in most cases, sign and agree to participate of their own accord. So you don't need to go through that additional thing. And if you went to an undergrad university like I did, there were school-based physical activity programs that you could participate in. Not all of them require it, but don't focus too much on the specifics of this one, just on how it translates into the variables. Okay, and you'll note here that we have the order is not quite Pico. It's been rearranged for clarity of reading. And you'll see that we don't have the t. We don't have the interval of time. Why? Well, because that's something that you will ultimately arrive at based on your literature review, and you're still at the point where you haven't done the full detailed literature review to determine that yet. So that's why it's just PICO, not PICOT so far. All right, so with this, what are we going to be tracking here for our demographic variables? And in this case, it's important to keep in mind that you may possibly end up having more than 3 descriptive variables that we need here. And if we're looking at this, okay, age and years, sure. But if we're looking specifically at obesity, we probably want to have more things here. And we're going to just rearrange this here to follow that alphabetical order I was talking about earlier. Let's add some more things here. And to add a new row, I can just right click and select insert rows below and add, all right, height. And maybe we start adding other things. And I'm not telling you how to do this. I'm just giving examples of descriptive variables that you might pick in relation to your Pico question. All right. And let's say that you looked at this and said, okay, I'm just going to add a little formatting here to keep that indentation so it's clear what's just continuing the line and what's a new one. So just added a little hanging indent there. All right, let's see, what else might you track? Well, our question here said, okay, college-aged adults, what is the effect of that program, the incidence of adult obesity? So that can be calculated from the other things, compared with no intervention. Okay. So we're going to need some measure of obesity, and BMI, I can determine that. Not required for this particular assignment, but you might also have what some people will call a derived variable. Now, BMI, while an imperfect measurement, does have defined in the literature the threshold of whether someone is classified as obese or not. So our derived variable here, I'm going to add another row here. That's going to be just obesity status. And our range of possible values here will be yes and no. Are they obese or not? Now the height is going to be, one of the things you might be doing here is you might decide that we have some outliers here. And looking at the general population data, we decide, okay, well, anyone who is, say, under 4 feet tall as an adult, we're going to exclude as being an outlier here. And in fact, anyone who's over, let's say, 6'6". So let's quantify that. Let's go in inches here. So let's say that, and you would want to have your exact values be based on the literature. here, but let's say that you're going with those, and we're saying, okay, 48 inches to 78 inches is our range of values here. Now, the fact that this is repeated here suggests that this should be actually height in inches. And so now we've condensed this to 48 to 78. Great, it's clearer. We're going to have everything be much easier to measure here. And so data source, oh, this is going to be derived from BMI. Race, ethnicity, you can break that down many ways, but you could go with just these standard things here and say, okay, this is going to come from a demographic survey that you give them, and the possible range of values, you're going to use just US Census categories. Now that's a placeholder. You can go in and put in Asian American, African American, Caucasian, and things like that, Asian Pacific Islander, Native American. But right now we're just putting that in as a placeholder here. And you would separate these different things with a comma. It's helpful to put those in alphabetical order. So our obesity thing, we'll put no and yes in that order. All right. And again, you might find that there's some outliers here. If someone has very little body fat because they're a professional bodybuilder, you might exclude them as saying, well, this is not really representative of the general population. The fact that we have these people here is great, but not going to include them in the study for these reasons. All right, age here's we're going to say 18 to, and if you say college age, well, that's somewhat variable. The average time to degree is somewhere over 6 years for a 4-year degree these days nationwide. So let's say that you make this 18 to 25. All right, and what else might be here? You might decide, oh, year in college. And you have, again, let's say 1 to 7. And it's not that people can't be students longer, but there are more potentially confounding factors the longer that they're in college. So if they exceed that, we're just going to exclude them from the study. All right, now let's talk about intervention and outcomes and how these might come up. Well, let's look back at our PICO question here. The PICO should be determining what is the effect of a school-based physical activity program. All right. So one of our interventions here is and again, I'm just going to add a little hanging indent to make it easier to see what's a new thing and see, okay, we've got 2 interventions there so far, whether or not they're enrolled in intramural sports. And whether or not they're enrolled in a PE course. Now, I'm not going to design this for you. I'm just giving illustrative examples here. And what could our outcomes be here? Well, you could be tracking as measured by their BMI change. All right. Or let's see, BMI at interval 1. We don't know what that will be because you have to do the study. And let's say that you do BMI at interval 2. Now, you might look at this and say, hold on, is it the BMI at those intervals, or is it the change? And the question is, well, what are we tracking here? Because you can do statistics to determine the change, but that we're really talking about data points here. So you can come up with what are called descriptive statistics, where you're describing the population, and you can come up with your analysis of the results to determine whether there was a significant change here. But what we're actually tracking, at least in the design here, we have our outcome, measuring BMI at one interval and another. And a later stage here might be to change interval 1 to, okay, BMI after 3 months. And that might change to BMI after 6 months. Now, something to keep in mind as you're designing this, let me zoom out a little bit. Table's getting bigger. Who is going to be collecting this? Now, we have also the time frame here. So you might see, oh, wait, this is actually looking at the population. This is actually supposed to be measured at multiple points. We have 0 and 3 months. And say, okay, well, hold on. Is this truly an outcome variable if we're going to be tracking it at multiple points? And so from that, you might go in and say, okay, change in BMI. Change in fat caliper measurement. Now, I don't think that the student participants here are going to be changing their height, but one of those things that comes up when we are looking at obesity, well, if you're trying to determine their fitness, they might be gaining muscle while also losing fat. And so this brings up a potential factor that one of the reasons we're asking you to do this now, rather than do all of this when you're doing the project, is that you might go back and say, okay, maybe adult obesity here is not going to be best measured by BMI. Maybe we need the combination of BMI and fat calipers here, because again, if you're going to bodybuilders, well, they might be very heavy for their height, but if that's a lot of muscle, we're not concerned with that. So you can see here that there may be some reformulations as you make your questions more detailed and more specific in light of the things that you're tracking. So don't focus on the particular examples here. Focus on the process of, yes, if I am tracking this, that is, we want to make sure that it is clear what we are actually collecting and from where. And so it might be whether you determine obese, you could define that in your description. When you're defining the term, you can say, who has a BMI of this, but has a fat caliper measurement of less than that. Or that could be you as the researcher go and measure that. So, like, as we go through this, you can get a more clear idea of what you're doing and what goes in there. See, oh well, yeah, their participant, you're going to have them do self-reporting there. All right, so it's coming from your survey, which is now no longer just a demographic survey. So we go here. I'm going to do a find and replace. And I'm going to replace demographic survey with entrance survey. So they fill this out when they enter. Right. So if we go about looking at this, say, okay, who would assist in doing this? This is going to be coaches. This will be the instructors for that, unless you are in fact teaching and coaching them yourself, which I will not rule out. We have a couple coaches who are also school nurses who are enrolled at ACU. So if that applies to you and you can actually do this yourself, not saying you can't, just that you're a busy person indeed. All right, so fill this out. It's going to be evolving. You will probably have some things that you tweak as you go. But in the end, you want to come back after you've drafted your table and go ahead and describe this. Okay, in terms of mentoring. Okay, so how are we going to define mentoring? Well, it'd be helpful to think about who will help open doors, who you'll need to advise, what kinds of advice. And so when you have a prompt like this, let's break that down and say, okay, number one, advice about how to recruit students, participants from this college. So that you might be looking for a college coach, perhaps, as your mentor. And you might also be looking at, say, advice on how to do the data analysis. Now, I don't know what particular PICO you yourself are doing, but you see the idea of if you start by looking at what do you need or what do you want from a mentor, that will help you look at it and say, okay, what do you need here? And that this is going to be on a spectrum of a lot of mentoring, like hand-holding all the process, to just a little bit of oversight here and there. But start with what you need or want here, and that lets you answer this question of, okay, well, who are you looking for? And let's say someone who has experience working with this population under study. And you can fill this in. Now, going back to what I mentioned here about approximate lengths here, so we have a couple things here. We have our three main sections in this data collection collaborators, which could be subsumed into this, but we've broken it out for now. But these are the three main sections. So if we're only talking a 2-page paper, we are talking 1, maybe 2 paragraphs maximum for this. It can't be too long because it's only 2 pages of body. So that gives you an idea of, okay, we want a succinct answer to this, and then following up with some detailed sentences about what that means. Now, for example, under the mentor, here's a place where you might use an I statement. And then you go ahead and move to this stage. Okay, I want to enlist a mentor with this, look at it and say, okay, a lot. I want someone who has significant experience. For example, it would be, and then list the characteristics that you want and why. All right, so this concludes our webinar for today. Let's do a quick recap of some of the ground that we've covered. So first off, we started by looking at the terminology for referring to different variables, which is a place where many students get confused and will use something that's related, perhaps spelled or sounds similar, but is not quite the term that they're looking for. So we started out, we looked at what are variables. We looked at descriptive variables and different types. It could be demographic data, participant characteristics like BMI, height, weight, etc. We can look at the independent versus dependent variables. The independent being something you're manipulating, like having an intervention versus not having an intervention. Talked about how you should not yell at people, but if you were doing a study on that, our independent variable would be how much employees are being yelled at, and our dependent variable would be their stress hormone levels. That'd probably be multiple dependents because those levels of cortisol and catecholamines, those are separate tests for each. Talked about descriptive variables, which are things that we report, but they're not being manipulated or controlled. So, for example, in the example table we were looking at, the descriptive variable would be the height. We're reporting it. We're not manipulating or controlling it in the sense that we're not stretching people out or squishing them down. You might have some screening where you are delimiting. The example we showed, I proposed screening out people who are under 4 feet tall and taller than 6'6", and we're using it to try and understand things. So you might notice some association. Oh, the people who are very tall are engaging in more sports than the other people. That would be worth looking into later. But we're not trying to use that to determine and things. It's just if we notice it and then it has an association, interesting. That might be something to follow up later. We talked about predictive studies where you're trying to determine whether one thing is causing a particular outcome. We talked about extraneous variables that might affect the outcome but are not part of the experiment, and how, in particular, confounding variables are something that you want to minimize or eliminate. And that when you're looking at correlation relationships, you're looking at the existence and strength of potential relationships. And it can be looking at variables with another factor or how a variable manifests in different types of participants, or how it seems to be associated with certain things in the participants. And talked about the connection with the PICOs and the eventual research, but wanting to focus on, okay, what are you trying to answer in this particular project right now, as opposed to what people do next, and making sure that your study variables have a clear alignment with that. Talked about APA table formatting. We walked you through how to format your table. Oh, by the way, when you are looking at the table in an appendix, if your appendix itself consists of a table, then you don't have the separate label, table 1, table 2, etc. If the whole appendix is just the table, just say, we'll get rid of all of this, then the title of the table here will be as part of the appendix title, appendix variables table in this case. And so there would not be a separate, table 1 variables table up here because the title of the appendix is fulfilling that function. Also, one of the reasons to start working on this and to do that preliminary table is that you may find that you are putting in too many things to track, or you realize there are more things that you want to track. And it's easier to look at that in the planning stage. And because sometimes you might say, okay, well, that would be great to have, but it's going to actually not be practical to collect that. Or that the time frame that you specify, like, okay, well, this is a 10-year thing. Oh, I would like to graduate in less than 10 years, so maybe I should find a variation on this that does not require that. All right, so we talked through the assignment. Reminder that you want to make sure that you are doing everything that the instructor has specified. So I do recommend that you copy and paste the instructions into the template and then cross them out as you've completed them to make sure you've done everything. Keep the body of your paper to 2 pages. That's not counting the title page. It's not counting the references. It's not counting the appendix with the table in it. and make sure that you have at least 3 references that are less than 5 years old. And with that, I think that we are done with our webinar here. Feel free to contact us. You can send us an email, schedule an appointment, find new resources on the Writing Center website, including dedicated webinars on things like table formatting. And with that, thanks for watching. Catch you later.